So it's 2 weeks, approximately 2 weeks after the cyclone hit Yangon and the Delta, and the Myanmar Red Cross continue to be inspiring in terms of their volunteers. We've seen today that a couple of the senior Grade 1 officers from the north have been deployed to the south, and they're telling us that they've got hundreds of volunteers that are ready to come and support the response on the Delta. Some of them have been volunteers for 10, 15, 20 years. Others have just come in because they see what's happening in the countryside and they want to do something. So they've just volunteered for the last 2 weeks or 1 week. And we're even at the stage where we have to turn back 10-year-olds and 12-year-olds who are turning up wanting to do something. Everybody in the community, it seems, is trying to get behind some kind of a response to this cyclone. And many of them have lost their families, have lost their houses, and are still wanting to give back to the community and the people that have survived this cyclone. We've seen in the Delta some of the most tragic stories, and then some of the humanitarian heroes that have come out of that tragedy. For instance, one 50-year-old man, we were talking to him when we were in the Delta. He stood to attention in front of the president of the Myanmar Red Cross, and he started to tell his story. Before that, he'd been stacking relief items onto a truck, and he looked just perfectly okay. But as soon as he started to tell his story, it would have only been 20 seconds into his story, he started to break down. And he said, "I've lost everything, and my family is living in the hospital." It was an emotional experience, I think, for not only myself but the president, as we realised this man, who'd been a volunteer for 30 years, was now back in the branch, trying to do something for other people who had survived. We proceeded down to the port, and at the port there was a first aid station with the most marvellous trained first aid volunteers. There would have been something like half a dozen young people trained in first aid who were already working with an elderly couple who I would only describe as bewildered. They didn't know what was going on. They'd arrived, they'd been travelling for hours from their village. The old man told us that his village used to have 3 houses, and now there stands 3. When we got down further in the Delta, we met 4 young volunteers who were riding their bikes outside the hospital, and it was already impressive that some prepositioned tarpaulins that were in the branch, in the Laputa branch, were used immediately for the roof of the hospital so that the hospital could remain functioning. We've distributed probably approximately 100 relief items for approximately 100,000 beneficiaries, or 20,000 families. 77% of that relief has gone to the Irrawaddy division currently, and 23% in Yangon division, with an operational decision to now concentrate primarily on the Irrawaddy division where the needs are so great. I think what we have to be careful of, and what we've perhaps learnt in the tsunami and other big responses, is that one of our most precious commodities are these volunteers. And I've seen how difficult it is for some volunteers and staff of Myanmar Red Cross to go home. They really just want to put in and put in and put in. It's really hard even for the Federation local staff to take a day off.